Namibia in southwest Africa is called the land of two deserts. The Namib on the Atlantic coast and the Kalahari to the east. Most of its people live in between, in remote villages and small towns.
As far as the eye can see.
Celebrating the vibrancy of Namibia's people, you might forget for a moment about the ongoing global public health catastrophe that will forever change the history of our planet. In 2015, Namibia became the first African country to implement Project ECHO, a global program that democratizes health knowledge and education and brings them to the last mile of healthcare, to rural and underserved communities.
So a patient with a CD4 count above 200.
Dr. Nuru Umgore is a specialist in a country that doesn't have enough of them. His clinic is near Oshakate in the far north of the country. Before COVID-19 came to Namibia, Dr. Umgore was already caring for over 3,000 people whose lives have been ravaged by much older diseases and other epidemics, by malaria, TB, and HIV.
So I've learned through participating on UNM ECHO project. Various specialists will be logged in and teach us without us going to the off-site or training centers to receive trainings. Because now in the past, we used to travel like 700 kilometers just to receive education trainings. But nowadays, we are sitting at our health centers, district hospitals, and participate in ECHO, and we are gaining knowledge from that.
So remembering that Namibia was the first country in Africa to implement these models.
Dr. Leonard Bikanizi, the chief HIV clinical mentor for the Namibia Ministry of Health, was instrumental in helping to start Project ECHO in Namibia. He and his team of specialists in HIV and TB are the clinical consultants and teachers in the so-called hub at the Ministry of Health in Windhoek, Namibia's capital. Every week, the outline spoke clinics, like Dr. Umgore's, connect to the hub for ECHO sessions.
So when COVID started in Namibia, we were not starting from ground zero. We had ECHO already that has been running since 2015. And within a short period of time, we had managed to train hundreds of healthcare providers in COVID case management, infection prevention and control. We also used ECHO to provide continuity of care. So clinical cases could still be coming. Even when there was a lockdown, cases could still be discussed and recommendation being given, and patients were still being managed.
17 countries in Africa have realized ECHO's potential and started their own programs. And by spring 2021, there will be another 40 to 50 programs in place.
ECHO makes you think differently. ECHO just helps you to understand that no one is really an expert. Everyone has got something to say and to share when it comes to the management of patients.
They've made the diagnosis. What should be done?
Sharing knowledge has been critical during this global pandemic, and the ECHO model was already in place to do just that. Almost 1,000 programs in 44 countries and growing. In 2003, India, the second most populous country in the world, became the first country to adopt Project ECHO. India has long struggled with poverty and disease, with trying to remedy health and social inequities.
ECHO has a goal to help 1 billion people by December 31st of 2025.
We're done with the 5 steps.
And ECHO has worked. It's influenced the education of over 1 million health professionals through 60 different programs. And perhaps most importantly, it's helped practitioners manage and treat the ever-present threats of TB, HIV, and hepatitis C. ECHO India's network was solidly in place when COVID-19 invaded the world. The chairman of ECHO India is Dr. Kumud Rai.
We had these networks, so when Corona or COVID struck, we leveraged these networks and used them, and I'm very happy to report that we have trained over 330,000 healthcare workers in COVID, and that was simply by leveraging our existing networks.
Even in this land of vivid colors, it's hard to miss the women in the pink vests. They are called Ashas, the Indian equivalent of community health workers. And their distinctive uniform means help is coming to the slums of Delhi and even out to the most remote villages. Ashas can be empowered by the ECHO model to help educate and vaccinate the people of India.
During this pandemic, we have gone door to door to survey and check on people. We asked them if they were showing any symptoms. We urged people to get tested and educated them about the risks and how they could inadvertently spread it in the community.
So Ashas are really the backbone of rural healthcare as far as healthcare workers are concerned. They are the ones directly in touch with people. We can mobilize them for vaccine advocacy and ensuring that people in rural areas, in underserved areas also get vaccinated. I think that will be a very big thing.
If that time arrives where we have the vaccines against COVID, or maybe the management of post-COVID syndrome, we can implement in training our healthcare workers who are living in remote areas, rural areas, to learn about COVID, how to do it, the distribution, are we going to, the supply chain, the cold chain about this vaccine, how are we going to keep it. We can learn via our ECHO platform as well.
Like the rest of the world, Namibia and India are confronting the resurging acute illnesses and the chronic diseases that the COVID pandemic has left untreated. TB, HIV, hepatitis C, and cancer don't stop for a pandemic. And then there are the lingering effects of the virus itself, so-called long hauler syndrome. Around the world, Project ECHO's infrastructure is in place to continue to fight disease and build community. It's a solid foundation, a democracy of knowledge.